You're about to see the hardworking people who produce an abundance of fruits and vegetables consumed throughout the world are suffering in silence in the fields of California. Now, a nonprofit health organization is determined to help change that. A little boy with special needs heads off to school. A mother cradles her newborn child. And a family pulls together for a better way of life. It's no longer just seasonal, but year-round that farm laborers flock to California's fields of gold. For decades, the state has stood out in agricultural production. Tons of fruits and vegetables are shipped across the state and around the world. And yet, the faces of the men and women who toil the fields of some of the richest farmland anywhere on this earth are suffering. And many are suffering in silence.
I come from an immigrant family. Came to the United States in 1962. So ever since then, we've known what working in the fields and the different issues the farm workers are facing then and now.
For the farm laborers who prepare the soil, plant the crops, and harvest the nuts, fruits, and vegetables that bring in billions upon billions of dollars every year, the issues facing these workers are very basic. Decent housing, fair wages, and access to health care.
Not having health insurance is one of the biggest factors right now.
Gracias, señora. This is one of the few free clinics in the San Joaquin Valley. A packed waiting room spills out to the parking lot.
The whole purpose of this clinic is to take care of patients that have no financial resources, no Medicare, no Medicaid, no kind of insurance.
Unfortunately, when it comes to farm workers, that's just about everyone.
I believe it was around 11% had access to some form of health insurance.
David Lighthall works for the California Institute for Rural Studies. He recently surveyed hundreds of migrant workers and their families. Families like this one in the community of Cutler, just outside of Visalia. Commissioned by the California Endowment, a nonprofit foundation, this is the state's first comprehensive study of health issues facing agricultural workers in the state of California.
We're not interested in pointing fingers per se at the agricultural business industry or at the government or even at the farm worker families themselves, but rather to find cooperative solutions that involves government, private sector, and the farm worker communities themselves to be able to provide a better life and better conditions.
A better life and conditions. The California Endowment found lots of room for improvement.
We have not been able to come up with an arrangement that allows people to work in this country and yet still have the fundamental labor rights that they should have as workers.
This labor camp is an example. These houses, as run down, dilapidated, and dirty as they are, were occupied up until just a few months ago. And in this same labor camp, new homes offer a glimpse of what America should look like, but only a glimpse. A family of 6 lives in this 2-bedroom rental.
Well, she said that when they first came, they didn't have any furniture at all. And little by little, they've been buying, like they just acquired the 2 mattresses, so now they can sleep on mattresses.
Also a big issue for this migrant family living on a farm labor wage of about $10,000 a year is access to health care. This 7-year-old boy has relied on his mother's home remedies for an ankle that's been swollen for several weeks now. In the Rubio household, 16 children live under one roof with their parents in a 3-bedroom home.
We don't have enough beds for them to sleep. We don't have enough chairs in the table.
The youngest in this family, an 11-year-old boy, has Down syndrome, but he's never seen a doctor. Neither has his dad, Salvador Rubio.
He just said that he's been here 20 years and hasn't ever gone to the doctor in 20 years.
And that's pretty typical. In fact, more than a third of farm laborers working in this country have never seen a doctor. More than 50% have never been to the dentist. What's more, medical exams supported by blood tests show farm workers are at serious risk for life-threatening chronic diseases caused by poor nutrition. This is the most comprehensive study ever conducted on these workers, and the findings were startling. For example, they're twice as likely to have high blood pressure than other adults in this country. 3 out of 4 were overweight or obese, and 4 times more likely to suffer from anemia. Add to that list high incidence of diabetes and elevated cholesterol levels. An excerpt from the study's conclusion reads, It is a tragedy and more than a little ironic that the labor force responsible for producing such a great abundance of healthy food in California should themselves be suffering from the effects of inadequate diet.
People are people, they're human beings, they're suffering, they're working hard here, and we have to help them.
But helping them, we're not. The work is hard, the hours long, usually from before sunup to after sundown. The wealth they produce for the state, abundant. The majority, about 66%, are documented laborers. That means they're here legally, and everyone who works the fields, documented or undocumented, pays taxes.
What we found was around $400 million a year is actually contributed by undocumented workers in the form of withholding taxes for state, federal taxes, for Social Security, Medicare, for workmen's compensation. That money is going largely to the federal government, and those workers are never going to see it.
Salvador Rubio is in his 60s, heading for retirement. He's only working during the summers these days.
He goes to work and he picks oranges.
Now his sons are laboring in the fields. His daughters go to school, do the cooking, and run the household. Days begin early. Everyone works hard. And at evening's end, the family gathers to give thanks to a way of life that is still difficult, but is so much better in terms of opportunities from where they came.
Well, he said God sees over all the family.
Coming up, we'll talk more with the people responsible for uncovering this crisis facing farm workers and their families. Stay with us. We're back in 2 minutes.
Have you had your daily checkup? KOVR 13's Diana Penna brings you medical information that can improve your life.
I had the breakthrough eye surgery that Diana reported on, and I am now able to see and drive again, and I'm very grateful to her.
Information that could save your life.
If I hadn't seen Diana's report on prostate cancer, I would have only had a few years to live.
Health news that is changing lives. Daily Checkup with Diana Penna. Weeknights on KOVR 13 News.
Help, I've fallen, and I can't get up.
The sad truth is that 1 out of every 3 seniors will have a serious fall this year. If you or a loved one are at risk, please consider the following. In a home emergency, even if there is a phone in every room of your house, your chances of being within reach of that phone are very unlikely. You could remain helpless, on the floor, cut off from the outside world. Don't risk lying on the floor for hours or even days. These one-time emergencies can easily turn into permanent disabilities. Why risk ending up in a costly nursing facility, losing your home and independence? Life Alert can help you avert a catastrophe with this simple pendant. Push it anywhere in your home or yard, and 24 hours a day, the Life Alert Security Center will summon the help you need. Fast.
Call 1-800-754-5055 to receive free information about Life Alert's round-the-clock 24-hour protection. The phone call and the information are free. Don't delay. Call this toll-free number now.
Well, it's that time of your life. How about a little gift from AARP? Surprise, it's only $10 to join, and you'd be amazed at what you get. Like our magazine, filled with useful information. Dozens of discounts, including hotels, car rentals, vision care, and more. And when you join, your spouse joins free. So call AARP now. Only $10 for all those benefits. Think of it as a gift to yourself.
Welcome back to This Week in California. We continue our look at farm workers' health. Joining me now is Don Villarejo. He is the former executive director of the California Institute for Rural Studies. Now, you started the Institute. Thank you very, very much for being here. The actual study was sponsored by the California Endowment, but you initiated this whole look at this crisis, really. Why did you start this?
I began working on occupational safety and health issues in California agriculture about 10 years ago. And in the course of that work, learned that there had not been any first-hand examination of this population with any kind of detail before. And I felt there was a major gap in our knowledge. So if we're going to have wise policy, if we're going to do things that make a difference, then we really need to know what we're talking about. We really have to have the baseline information.
That's right. This was the first of its kind to actually do the medical tests on some 700,000 farm workers right now currently working in the U.S. And this probably represents what's going on out there.
Yes, it does.
Why did you start the Institute?
The Institute was started 24 years ago at a time when there wasn't very much original field research going on in California agriculture. And what I'm talking about are the working conditions, the risks to health due to pesticide exposure, controversy around use of water, land use issues, these kinds of things. Very little field research was going on. So I wanted to start an institution that would be solidly based and grounded in talking directly with workers, with farmers, with rural residents, and finding out what their lives are actually like.
Boy, and you know, it's a shocking look, really, looking at the homes that they lived in, one. Two, most have never even seen a doctor.
Yes.
And that they make $9,500 a year. That's what the report found on average, correct?
Actually, it's between $7,500 and $9,500 a year is the range. We only ask for ranges of income. People are pretty sensitive about exactly how much they make. So it's in that range. Yes, it's just appalling. I can imagine how difficult it must be to live on that kind of income in a high-rent area like California.
We first ran this story during our newscast, and we got a lot of response regarding the part about taxes and paying money to the government, even though many of them are undocumented. Explain that and maybe clear up some of the confusion there. They do pay.
Yes, they do. Every employed person who earns more than $100 in a calendar quarter must pay taxes to both the state and federal government. The amount of taxes paid, of course, depend on your income and deductions and things like that. But the federal government just revealed yesterday that there's about $4 billion in the Social Security Trust Fund for which the government cannot account. That is, people who don't have valid Social Security numbers. So those are people who are mostly working in this country as undocumented workers. That's an awful lot of money sitting there. Every year in California, according to another study done by the California Institute for Rural Studies, about $400 million a year go in taxes paid by undocumented workers just in California. So there's a lot of tax money flowing in, and most often those folks never get any services back.
What do you think is lying ahead in the future? I know we're going to talk about this a little bit more with our second guest coming up in our half-hour show here. Do you think this was going to prompt some change?
It already has. There are several initiatives underway. The California Endowment, for one, has committed just 2 weeks ago $50 million in new grant monies in California to address the issues that were uncovered in this study. That is, new services and programs to provide needed health services to this population. Another foundation, the California Wellness Foundation, has committed $1 million this year and up to an additional $4 million over the next several years to initiate programs of its own. And then finally, there are some initiatives coming from the state government itself.
We were lucky to be able to go to the Good News Center, I believe the name of it is, and all of the wonderful workers there. Our producer, Joyce Mitchell, was allowed this access, which was also first of its kind, to be able to gain that trust to go in and see really how these families live. And really, I think what struck us all is the strength of the family. And really, when you sometimes feel that that's all they have at this point, now that they're going to get some help, it's kind of hope is there at the end.
Oh, yes. Sister Bautista, who was in your piece, is a wonderful, wonderful lady. They are providing the frontline emergency services that are not available to many of these workers, their families, and their children. In fact, very recently, I had the privilege of meeting with her, talking with her at some length, and then meeting a family, including a woman just 23 years old, 3 kids, who has cerebral palsy, and has no place to turn for medical care except the Good News Center. And so it's a kind of a miracle in a way that Sister Bautista and her colleagues are out there doing that wonderful work.
You also made a point to tell me earlier before we started our taping here, you did show this story to some, I guess we can call them political bigwigs, and what was the response there? Something eye-opening for them, because it certainly was for our viewers.
Sure. The California Endowment created a 24-member Blue Ribbon Task Force this January in response to this report. Included on the task force were 4 members of the California legislature, including the chairs of both the Senate and Assembly Health Committees, as well as Diana Ponta, who is the director of the Department of Health Services. They were shown that piece, the 6-minute piece that you all produced, and were very moved by it. They had not seen that kind of information. It's one thing to read a report like the one we did.
Right.
It's another thing to actually see people's faces and see the feelings that are underneath what is going on out there, and they were quite moved.
Well, and then the report is pretty visual as well. I mean, it's called Suffering in Silence, but really when you have TV cameras and being allowed to go in there and really tell the story and show the story, you're certainly right. Don, we appreciate you being here this morning.
Thank you. It's been a pleasure.
Very much. Thank you. We'll be right back.
It's time to head to the ballpark.
And step up to the plate for a good cause.
It's the Black Tie and Tennies Dinner with the River Cats, Wednesday, May 16th.
It's a special night on the field with great food.
Photos with the players.
And lots of games and entertainment.
Proceeds benefit People Reaching Out, which provides free drug prevention services to kids and families in the Sacramento area, and the River Cats Foundation.
So, don't miss this Grand Slam event.
For ticket info, call that number on your screen.
Are you tired of all those phony, so-called psychic phone lines? Well, so are we. We are the American Association of Professional Psychics, and we are the real thing. Don't be fooled by highly paid celebrities. This is the one, the only one with certified authentic psychics. Experience the difference of a real psychic reading. Call 1-800-244-2552. The call is free. Call now.
Come to a place where the power of legend has a presence unlike any other. Ancient legend tells of a time when conquistadors blazed new trails in search of the legendary cities of gold. But the only treasure they discovered was the brilliant sunlight reflecting the golden hues of the many pueblos still in existence today. For some, Route 66 was the road to freedom, an endless wave of adventurous possibilities. More than just a stretch of road, Route 66 was a way of life. What was once a road of the future is now a route to the past. Come to New Mexico, where legends are as much a part of the landscape as our open skies. Put yourself in a state of enchantment. Call for your free vacation guide today.
And welcome back to This Week in California. We're just continuing our discussion of farm workers' health and a major new study out by the California Institute for Rural Studies. We thank David Lighthall now for joining us. You are the current executive director for the Institute, and of course one of the primary researchers here. Let's just reiterate some of the findings. We have it here in front of us, Suffering in Silence. We're talking many of these farm workers have never seen a doctor, have never seen a dentist, and obviously the consequence of that is that they have many diseases that are going untreated.
Yes, maybe not so much many diseases, but the question becomes, what happens to a population of people who are not seeing doctors?
Correct.
Okay. A couple of things that are important to remember, too, is that this population is particularly at risk, at least based on the research that we've done. Relatively high number of people who are not healthy weight. We have a population that we now know is genetically predisposed. Those people of Mexican ancestry are predisposed to diabetes. And at the same time, very low levels of access to care. Okay. And so what happens in very low levels of health insurance and low income? Okay. So what happens to this population over time as this risk to heart disease and diabetes, and stroke and so forth proceeds? One of the things that we know about diabetes is that it actually can be prevented, okay? It can be controlled, right? But what do you need to do? You need to have a good relationship with a healthcare provider.
And a nutritionist, because diet is so important.
Exactly. There's all this kind of support that many of us take for granted because we have health insurance. And I know myself, I probably take that for granted, and I think we're all probably in that boat. So what happens over time when you have this population that has very low access to care, and this disease starts to proceed. Then what we end up with is a much, much more expensive and debilitating set of outcomes.
How did you go about the testing? You actually did blood work. You did quite a few things.
Yes, what we did is we had 7 communities that we worked in, and of course Don Villarejo gets credit for setting up this wonderful research design. We established a relationship with a local clinic in each one of these farm worker communities. And essentially then what happened was we would go and do a home interview that would take quite a while, about an hour and a half to 2 hours. Then we would offer them a $30 honorarium if they would come to one of the local clinics and have this physical exam, have a blood sample drawn, and they would also then have a chance to come back and get the results read back to them. And so that was how we essentially induced people to come in and get the physical exam.
Boy, you know, when you don't have health insurance, it's not a problem of patient compliance. It's just a matter of even getting the help and the knowledge and the information to take care of your families. Were you surprised with the findings, or did you kind of know what you were going to find?
I was surprised and saddened. I remember looking at the dental data and feeling very bad.
And why is
about
that an example?
Well, it was because so many people had cavities or had missing teeth that were suffering with dental pain, which I think is one of the kind of thing that you and I, when we have a cavity, what do? We cry and moan and we rush off to the dentist. So I think that the dental is a classic example of what the title implies, or title states, and that is suffering in silence.
Very good point. Implications down the road. Who can help? Who can make this situation better?
Well, I think that one of the first steps is exactly what you and KOVR are doing, and that is informing the public about this issue. Okay, we have a situation where the labor of these folks is keeping the price of fruits and vegetables, the healthiest food that we can consume, it's keeping it low in this country.
Isn't it?
Because it's very abundant, the labor costs are relatively low. California growers have stepped up to the plate. They're increasingly planting around 80,000 acres a year of more fruit, vegetable, and horticultural crops. And so we're keeping the supply up. We're keeping the price of this very healthy food low, so it's accessible to all Americans. Okay. So the question then becomes, what do we do to keep these workers healthy? And I think one of the things that we have to accept is that we have to go beyond seeing this just as the responsibility of the growers. These are seasonal workers. They're part-time. Very few corporations in America provide health insurance to their part-time workers. It's very difficult for this industry to pass on costs. I think the critical thing that I would argue is that we all, as food consumers, as those of us who benefit from these very low prices for fruits and vegetables, we have a collective responsibility. And I don't have any kind of magic solution in terms of public policy at this point, but one of the things that we're working towards in the future, slowly, is some kind of program that would provide health insurance for this population, and that the funds for that would come from from all of us as food consumers.
David Lighthall, we appreciate you joining us. We're going to continue to follow this issue and hopefully have it remedied very soon. We appreciate you joining us for This Week in California. Stay with us. An important program to tell you coming up next.